What is the criteria for BVM ventilation?
The indications for performing BVM ventilation are hypercapnic respiratory failure, hypoxic respiratory failure, apnea. Also, some patients who are endotracheal intubation may require BVM ventilation.
The bag valve mask, or BVM, is possibly one of the devices that is likely to be one of the most effective pieces of equipment in saving the patient's life. However, it is very often used with little to no training and as a consequence not very effectively. Are you right? Ventilation of the patient is the most important part of the process of intubation. Why? If you can ventilate, then an inability to intubation becomes less of a problem. You can continue to ventilate and get time management. You are right. There are two ways for the novice user to apply the face mask to the patient's face. Who knows?
Superior bag mask ventilation can be achieved with 1 or 2 rescuers, and 2 rescuers may be required when the victim has significant airway obstruction or poor lung compliance.
You are right. But there are two ways to apply the face mask to the patient's face: the wrong way and the right way. One method taught for holding the mask to the face was the easy clamp. This is a grip in which the thumb and index finger hold the mask down over the nose and mouth of the patient, forming a C, while the other 3 fingers of the hand grasp the patient's mandible, forming an E. Here are a few things to avoid.
I know. Not properly positioning the airway. Pushing the mask into the face.
Why?
Pushing the mask down on the face, instead of lifting the jaw into the mask, pushes the tongue against the back of the throat and obstructs the airway.
You are right. Yet some things to avoid: not maintaining an effective seal, overventilating and hyperventilating, giving too much volume or going too fast could push air into the stomach, resulting in gastric insufflation. This could lead to vomiting and subsequent airway obstruction or aspiration.